Myofascial release is safe and very effective hands-on technique that involves applying gentle sustained pressure into myofascial connective tissue to eliminate pain and restore motion. Myofascial release focuses on releasing muscular shortness and tightness. Many athletes seek myofascial treatment after losing flexibility or function following an injury or intense exercise. Various postulated mechanisms may explain why using the stick or foam rolling enhance the recovery from muscle tenderness and associated dynamic performance measures throughout 72 hours post-exercise. The most common mechanisms are decreased edema, enhanced blood lactate removal, and enhanced tissue healing, which are mainly due to the increased muscular blood flow. Increased blood flow hinders the margination of neutrophils and reduces prostaglandin production, subsequently decreasing inflammation. Massage-induced muscular blood flow also increases oxygen delivery, which encourages mitochondrial resynthesis of adenosine triphosphate and the active transport of calcium back into the sarcoplasmic reticulum. These processes facilitate an optimal recovery and an increased performance.
All right, guys, hey, listen, we have two different resources here, right? We have the foam roll and we have what's known as the tiger tail or the stick. Both of these apparatuses are used as either part of a warm-up strategy or part of a recovery regeneration method for training of athletes. And if you're going to ask me if I have a preference on one or the other, I think here is how, and I have both of these tools in my toolbox that I use with athletes. I think this is how I would approach this. The tiger tail or the stick, this can be used by the athlete to be very specific. And remember, what's your goal? What are you trying to accomplish with these? Well, obviously it's a soft tissue manipulation. You're looking at how can you facilitate some myofascial enhancements so the tissue can be prepped ready for activity. With this tiger tail, the athlete can get a little bit more specific whenever they're using it on whatever body part or soft tissue there is, and they can get a little bit more dynamic, a little bit more specific, and a little bit more involved. Where with the foam roll, this here, and again, I'm using my hands to help facilitate and use this. Now, here with the foam roll, you have to use your body, right? I have to lay my body on top of this and I have to roll. So my preference is to use the tiger tail or the stick as part of the warm-up strategy prior to activity, and get as specific as you can on whatever area you're going to be focusing on for that workout. And then after the workout for regeneration, let's use the foam roll and let's take the body and elongate the entire body to maybe look at some form of additional either static stretching as part of the recovery, and then foam rolling for some of that soft tissue myofascial release and recovery. That's my preference.
Human movement is dependent on the amount of range of motion available in synovial joints. The most common theory used to explain the increased range of motion in myofascial release is the thixotropic property of the fascia. This theory explains that when undisturbed, fascia becomes more viscous and takes on a more solid form, which can restrict movement. If heat from rolling friction, mechanical stress, massage, or pressure is applied to the fascia, it can become more gel-like and pliable, allowing for a greater range of motion. There are many factors and reasons for reduced joint range of motion, only one of which is muscular tightness. Muscular tightness results from an increase in tension from active or passive mechanisms. Regardless of the cause, tightness limits range of motion and may create a muscle imbalance. A roller massager can improve
using static stretching versus using a tiger tail or foam roll or some other apparatus for recovery. Because typically you don't do that type of exercise prior to performance or toward training, because you don't improve or reduce the risk of injury, and you don't improve performance. But doing it after exercise or doing it as part of a rehabilitation program is excellent to not only improve overall flexibility, but also to break up adhesions within the connective tissue and to increase local flexibility or local range of motion. One of the areas that the tiger tail is used regularly is on the iliotibial band, the vastus lateralis, regions that tend to be very tight in athletes. So the tiger tail or a foam roller allows you to apply some pressure more specifically to that region to help to improve the range of motion and help to improve knee stability.
There are many methods to improve range of motion. Two of the most popular methods are static stretching and self-massage. Both improve range of motion acutely and chronically. Stretching places strain on the origin and insertion of the muscle and may cause damage to the sarcomeres. A lengthened muscle could have less than optimal cross-bridge overlap, which according to the length-tension relationship could diminish muscle force output. On the other hand, self-massage improves range of motion without adversely affect of muscle performance. A study on ankle range of motion shoes, both static stretching and roller massage significantly improved ankle range of motion to a similar degree of self-massage protocol, led to a significant improvement in force production relative to static stretching protocol. In conclusion, roller massage can statistically improve range of motion without decreased power and force production. It promotes myofascial release without interfering with the force-strength relationship.